Welcome back. Today I'll be continuing with neuroanatomy. Last time we discussed about brainstem, and that day we discussed about medulla. I'm continuing with the brainstem today, and today's topic will be pons. So before moving on to the pons, let's have an overview of the brainstem. We can see that the brainstem is made up of three parts: the midbrain, pons and medulla. This portion we have already discussed. You can see the link. And today we will be dealing with pons. So when we discuss about pons, what is pons? What is the word meaning of pons? Pons means bridge. Why this pons is called bridge? The reason is this part of pons is actually seated in the posterior cranial fossa, and this is actually seated in front of the two cerebellar hemispheres, and we can see that this pons is actually continuing as the middle cerebellar peduncle, and this will be connected to the two cerebellar hemispheres. So this acts like a bridge connecting between the two cerebellar hemispheres. Hence we call this portion of brainstem as pons. Now we will be discussing the pons under the two main headings: the external features and the internal features. First we will be seeing the external features. When we talk about the external features of pons, we can discuss it under four main headings. That is the ventral surface, the dorsal surface, the superior border and inferior border. So let's see the ventral surface first. So this is the ventral surface. So when we take the pons, this is the part which is facing anteriorly, and you have the two cerebellar hemispheres seated at the back of pons. So this is known as the ventral surface of pons. What are the features which you can make out in the ventral surface? You can see that basically the ventral surface of pons is striated, transversely striated. And what gives the striated appearance to the pons? It is basically the cortico-pontocerebellar fibers. So you have the pontocerebellar fibers running transversely along the pons and which are moving to the cerebellar hemispheres, and these transversely running fibers will give a striated appearance for the pons. And in the middle you can see a groove. This is known as basilar groove. So why is it called basilar groove? You have the basilar artery. You have the two vertebral arteries joining at the lower part of pons to form the basilar artery. So this basilar artery is lying in the basilar groove. Hence this groove is known as basilar groove. And what are the other features you can see on the ventral aspect? When we talk about the cranial nerves in general, in the last session I have already mentioned, we can say that 3rd and 4th comes from midbrain, 5, 6, 7 and 8 comes from pons, and 9, 10, 11, 12 comes from medulla. That is a general rule. So on the ventral surface of pons, we can see in the upper part you can see two nerve roots coming, and one is larger, the lateral one is larger and the medial one is smaller. These are the roots of the cranial nerve known as trigeminal nerve. So the 5th cranial nerve, the trigeminal nerve, arises from the ventral surface of pons in the form of two roots. Trigeminal nerve is mainly a sensory nerve. Hence, which root will be larger? The lateral root, the sensory root will be larger. So laterally you can see a larger root, that is the sensory root of trigeminal nerve, and medially motor, that is MM. So medial root will be the motor root, and that will be smaller. And what about the rest of the cranial nerves? You have 6, 7 and 8. These will be arising from the pontomedullary junction. This is known as the pontomedullary junction. So this is the 5th cranial nerve, and at the pontomedullary junction you have the 6th, you have the 7th and you have the 8th cranial nerves emerging. But there is one more nerve lying between the 7th and 8th. What do you call that nerve? This nerve is known as nervus intermedius. Nervus intermedius. So have you heard about nervus intermedius as any a part of any cranial nerve? Yes, nervus intermedius is a part of facial nerve, and it carries the sensory and parasympathetic fibers. So we can see that these two nerves are emerging separately. The motor part of the 7th cranial nerve as well as the nervus intermedius, they are said to be emerging from the ventral surface at the junction of the pontomedullary junction as two separate nerves, but these two nerves unite in the facial canal of the medulla. and as the facial nerve comes out, these two components will be united. So these are the cranial nerves which you can make out on the ventral surface. Suppose if you draw an imaginary line just lateral to the fifth cranial nerve. Suppose you draw an imaginary line, vertical line like this. This line acts as a demarcation plane between the pons and the middle cerebellar peduncle. So this is the middle cerebellar peduncle. So if you draw an imaginary line just lateral to the fifth cranial nerve, you will get a plane which will demarcate the pons from the middle cerebellar peduncle. Now you have an superior border and an inferior border. What you can see at the superior border is, you can see the two cerebral peduncles. These are the two cerebral peduncles. You can see that the cerebral peduncles, as it reaches the superior border, it is actually getting immersed into the pons. And what you can make out at the inferior border is, it is actually continuing down as the pyramid and the rest of the part of the medulla. So, is there any artery lying in the superior border and inferior border? Yes. You have the two branches of the basilar artery. Here you get the superior cerebellar artery, and along the inferior border you have the anterior inferior cerebellar artery, ICA. So along the superior border you have the superior cerebellar artery branch of basilar artery, and along the inferior border you have the anterior inferior cerebellar artery. So when you look at the ventral surface, you have the three arteries related to the ventral surface. Along the basilar groove you have the basilar artery, along the superior border you have the superior cerebellar artery, and along the inferior border you have the anterior inferior cerebellar artery. Let's have a look at the dorsal aspect. Dorsal aspect, we have already seen that the dorsal aspect of pons and medulla forms the floor of the fourth ventricle. This is actually the floor of the fourth ventricle. So the upper half, which is triangular in shape, is actually formed by the dorsal aspect of pons, and the lower half, which we have already discussed, is actually formed by the dorsal aspect of medulla. So now today we have the dorsal aspect of pons here. And what are the features which you can make out? The details of the fourth ventricle will be dealt in detail in another session. For the time being, I will say about two important structures which you will be seeing on the dorsal aspect. This swelling or this elevation is known as facial colliculus. Facial colliculus, and this region is known as vestibular area. So facial colliculus and vestibular area, these are the two important structures which you should know because this will be useful if you know when we discuss about the internal structure of pons. And along the upper part you can see a bluish grey area. This is known as locus ceruleus. Why this is called locus ceruleus? Actually, the nerve cells here will be having a pigment known as melanin, and this melanin is actually giving a bluish grey color to this region, and it is said that it is rich in noradrenaline. Now we will move on to the internal structure of pons. When we talk about the internal structure of pons, we can divide the pons into two parts: a ventral basilar portion and a dorsal tegmental portion. You call the dorsal portion as tegmental portion and the ventral portion as basilar portion. So if you just compare these two parts, we can see that the basilar portion is almost the same, and the changes happen for the dorsal tegmental portion. So this portion is known as basilar. So the basilar portion is almost the same throughout the pons, whereas the dorsal tegmental portion differs. So at which all points does the dorsal tegmental portion differs? So we can take two sections of pons in order to explain the internal features of pons. One at the lower aspect of pons and one at the upper part of pons. Lower part of pons you will get the facial colliculus and vestibular area, and in the upper part of pons it is actually roofed by a layer known as superior medullary velum. Superior medullary velum, and this superior medullary velum will actually close the fourth ventricle. So you will have a part of fourth ventricle as a closed part in the upper part. If you take a section of the upper part, you can see a closed portion of the fourth ventricle because of the presence of superior medullary velum, but in the lower part it is actually open. So let's see the features of both upper part and lower part of pons. So let's first discuss about the ventral basilar portion, ventral portion of basilar portion of pons. So whenever we discuss a part of brainstem, we know that it is made up of white matter as well as grey matter. What is the grey matter which you get in the basilar portion? Here you can see many rounded nuclei. These are known as pontine nuclei. So this is the grey part of the ventral or basilar portion. And what about the white matter? White matter, you have longitudinal fibers as well as transverse fibers. So the longitudinal fibers are actually the fibers running through the cerebral peduncle, and they will be reaching here to the pons. So what are the sets of longitudinal fibers which you get through the cerebral peduncle? You have three sets of fibers. They are corticopontine, corticonuclear and corticospinal. So all these are starting with the word cortico. That means they are arising from the cerebral cortex, and they run along the cerebral peduncle in order to reach the pons. So these are the vertically running fibers which you get here: corticonuclear, corticopontine and corticospinal. And we have already discussed in medulla that the pyramids are actually the corticospinal fibers. So the corticospinal fibers will be running through the basilar portion, and it will be continuing as the pyramids of medulla. What happens to the corticopontine fibers? As the word implies, the corticopontine fibers reach and relay in the pontine nuclei of the same side. And from this pontine nuclei, the fibers will cross to the opposite side as pontocerebellar fibers, and they will be reaching the cerebellum through the middle cerebellar peduncle. We have already mentioned that this is the middle cerebellar peduncle. So the pontocerebellar fibers will be reaching to the opposite side of cerebellum as pontocerebellar fibers, and they will be passing through the middle cerebellar peduncle. So that is the corticopontocerebellar fibers. Now what about the corticonuclear fibers? Corticonuclear fibers will be descending through the cerebral peduncles, and they will be actually relaying in the opposite side of the motor-cranial nuclei. So these are the three sets of fibers which you get in the basilar portion. And so you can say that the longitudinal bundles are the corticopontine, corticonuclear and corticospinal, and the transversely running fibers are the pontocerebellar fibers. So that's about the basilar portion or ventral portion. That is the same whether you take a section at the lower part or whether you take a section at the upper part. The changes are actually happening for the dorsal or tegmental portion. I would like to add one more point. The pontine nuclei, some of the pontine nuclei during embryogenesis has been displaced into the medulla, and we have already discussed those pontine nuclei as arcuate nuclei. Just keep that point in your mind. Now we will discuss about the dorsal tegmental portion of the lower part as well as the upper part. So let's discuss first the lower part. So again, when we talk about the brainstem, we can put it as the part belonging to the white matter and part belonging to the grey matter. First we will discuss what are the components of grey matter which you get in the dorsal part. So grey matter means basically the nuclei. So if you take a section at the lower part, which are the nuclei you will be getting? So suppose imagine you are taking a section at this level, which are the nuclei? You will get all the cranial nerve nuclei. You will get 5, 6, 7 and 8 cranial nerve nuclei in this section. 5 is actually, that point you have to remember, the 5th cranial nerve nuclei is the only cranial nerve nuclei which you will get throughout the brainstem. Whether you take a section at the midbrain, whether you take a section at the pons, or whether you take a section at the medulla, you will get one of the component of the 5th cranial nerve nuclei. So if you take a section at the lower part of pons, you will get all the 4 cranial nerve nuclei in this section. So let's see where are the cranial nerve nuclei. So this is the 5th cranial nerve nuclei, the spinal nucleus and spinal tract of trigeminal. Where is the 6th one? This is the 6th one. This is the 7th one, and 8th, these are the vestibular components, and these are the cochlear components. So vestibular and cochlear together form the 8th cranial nerve nuclei. So 5, 6, 7 and 8. All the 4 cranial nerve nuclei you will be getting in this section. And this elevation is actually the facial colliculus. So what do you mean by facial colliculus? Just under the facial colliculus you have the abducens nerve nucleus, and you can see that this is the facial nerve nucleus. This facial nerve emerging from this nucleus is actually winding around the abducens nerve, and this is actually causing the elevation here, and this is known as the facial colliculus. Why this facial nerve is actually causing an elevation? So during embryogenic period, the facial nerve nuclei is said to be lying on the dorsolateral aspect. This was the first position of the 7th cranial nerve nuclei. Later what happened is this has to reach nearer to the trigeminal nucleus. Why the facial nerve nucleus is trying to reach towards the trigeminal nucleus? We know that the face is supplied by 2 major nerves. The sensory component comes from the trigeminal and the motor component comes from the facial nerve. So for quick responses, for quick reflexes, the motor nuclei should be ideally lying closer to the sensory nucleus. For that to happen, the first position, which was lying about dorsolateral to the abducens nucleus, is actually shifting from the dorsolateral position, then to the dorsomedial position, then it comes to the ventromedial position, and finally it will be lying on the ventrolateral aspect. So along its course it will be winding around the abducens nucleus, and that is how the facial colliculus is formed. And this process of shifting is known as neurobiotaxis. Neurobiotaxis. This method of shifting of the facial nerve nuclei towards the trigeminal nucleus is known as neurobiotaxis. So apart from 5, 6, 7 and 8 cranial nerve nuclei, you have some other sets of nuclei as well, lying medial to the dorsal motor nuclei of facial nerve. They are the superior and inferior salivatory nucleus and lacrimatory nucleus. Superior and inferior salivatory as well as lacrimatory nucleus. The superior salivatory nucleus is actually going to the 2 salivary glands, submandibular and sublingual, and they actually form a part of facial nerve. Inferior salivatory nucleus is actually going to parotid gland, and they are said to be actually a component of glossopharyngeal nerve. And lateral to the motor part, you can see one more nuclear complex, that is known as nucleus tractus solitarius. Nucleus of tractus solitarius. So 2 groups apart from the 5, 6, 7 and 8 cranial nerve nuclei. So that's about the grey matter. Let's see about the white matter, that is the ascending and descending tracts. In the midline you can see the medial longitudinal fasciculus first, then you have the tectospinal, and then you have the rubrospinal. So these are the 3 paired sets of fibers you will be getting: medial longitudinal fasciculus, tectospinal and rubrospinal. And what are these 2 bundles of fibers? These are the medial lemniscus, medial lemniscus, and this is said to be the spinal lemniscus. The formation of medial lemniscus has been discussed in detail when we discussed about medulla. They are actually formed after the sensory decussation, and the spinal lemniscus is actually the upward continuation of the spinothalamic tract. But when we discussed in medulla about the medial lemniscus, it was actually there I have drawn this as a vertically aligned structure, but here I have drawn it as horizontally aligned structure. That point you have to keep in mind. So this is medial lemniscus, then you have the spinal lemniscus. Now you can see a trapezoid body in the middle. So what do you mean by a trapezoid body? Trapezoid body are nothing but the fibers formed after the decussation. So where are these fibers coming from? They are coming from the cochlear nuclei. So the fibers from the cochlear nuclei will be decussating in the middle, and that is how we get the trapezoid body. So once again, when we take a section at the lower part of Pons, you can discuss it under the 2 headings, the grey matter and the white matter. Grey matter, you will be getting all the 4 cranial nuclei, 5, 6, 7 and 8. and along with that you will get extra nuclei like superior inferior salivatory nucleus, lacrimatory nucleus, and the nucleus of tractus solitarius. When we discuss about the white matter part, we can see in the midline, along the midline on either side you can see the medial longitudinal fasciculus, tectospinal fibers and rubrospinal, and you have the medial lemniscus and the spinal lemniscus. Now let's see how is it differing in the upper part of pons. We have already discussed that the fourth ventricle is actually closed in the upper part by a roof, that is superior medullary vellum. And again, now we will be discussing it under the two main headings, the grey matter part and the white matter part. Grey matter part, we can see that here. So if you consider this as the upper portion, you can see that you will get only the fifth cranial nerve nuclei in the upper part. You won't get 6, 7 and 8 as we have discussed in the lower part. So it is the upper part of pons and you get only the fifth cranial nerve nuclei. So we have seen that the motor part is medial, M for M. So this is the motor nucleus of trigeminal, and laterally you have the larger sensory nucleus of trigeminal, and in between you can see one nerve. So the nucleus is not shown because the nuclear portion of this nerve is actually lying in the midbrain. That is actually known as the mesencephalic part of the trigeminal. So these three will be forming the trigeminal nerve in this region. So you will get only the fifth cranial nerve nuclei in the upper part. Now what about the white matter part? White matter part, along the midline on either side, the set is the same, the medial longitudinal fasciculus, then you have the tectospinal, and then you have the rubrospinal. And the fibers which are aligned transversely, here we have only the two set of fibers. They are the medial lemniscus and spinal lemniscus, but here we can see four sets of fibers on either side. So this is the medial lemniscus and this is the spinal lemniscus, but we have two more. What is this? This is known as trigeminal lemniscus and this is known as lateral lemniscus. So what are these trigeminal and lateral lemniscus? In order to know this detail, let's see what are the other features missing here. We are not showing the spinal tract of trigeminal. So where is it? Where has it gone? Here you get the spinal tract continuing upwards as the trigeminothalamic fibers. So that is how you get the trigeminal lemniscus. So trigeminal lemniscus is nothing but the continuation of the spinal tract of trigeminal as trigeminothalamic fibers. So trigeminothalamic fibers continue upwards as the trigeminal lemniscus. And what is this lateral lemniscus? So any other structure missing in this region? Yes, you are not showing this trapezoid body here. So what happened to the trapezoid body? So trapezoid body from the lower part is ascending upwards as the lateral lemniscus. That is the reason why you are not showing trapezoid body in the upper portion. So you have the four lemniscus. Once again, the medial lemniscus, which is actually formed after the sensory decussation in the medulla. Then you have the trigeminal lemniscus, which is nothing but the spinal tract of trigeminal nerve ascending upwards to the thalamus as the trigeminothalamic fiber. Then you have the spinal lemniscus, which is nothing but the spinothalamic tract ascending upwards, and the lateralmost one is known as the lateral lemniscus, which is actually the continuation of the trapezoid body upwards. So how to remember the lemnisci in an order from medial to lateral? There is a code known as my tongue speaks loud. M stands for my, T stands for tongue, S stands for speaks, and L stands for loud. My tongue speaks loud from medial to lateral. Medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus. So, and on either side of the fourth ventricle, you can also add the superior cerebellar peduncle. And the ventral portion or the basilar portion is one and the same whether you take a section at the lower part of pons or at the upper part of the pons. That is, you have the pontine nuclei and you have the bundles of white matter in the form of longitudinally running fibers and transversely running fibers. Longitudinally running fibers are the fibers which are coming down through the cerebellar peduncle. They are the corticopontine, corticonuclear and corticospinal, and the transversely running fibers are the fibers running from the pontine nuclei of one side to the cerebellum of the opposite side along the middle cerebellar peduncle. So these are the features which you will be getting when you take a section of Pons, and we can see that the cerebral peduncle, which is actually coming from the cortex, will be entering into the Pons, and some of the fibers will be going to the cerebellum, and the remaining fibers, that is the corticospinal fibers, will be running through the medulla as the pyramids, and the dorsal portion of medulla is actually ascending up along the dorsal portion of Pons. So these 2 points you have to keep in mind. So these are the features of Pons in a nutshell, and I'll be dealing with the blood supply of the entire brainstem in another session along with the clinical features. Thanks for watching. I would like to hear from you. Thank you.